Hello, and welcome to another informative presentation from OfficeFlow by the Enterspace Group. In this presentation, we're going to talk about your transition to retirement and how you can make it worry-free. Here's a checklist of what we'll discuss. We'll talk about the announcement you should make before you retire. We'll talk about what to do with patient records. We'll talk about what to do with your patient portal, if you have one, or if you're a member of another portal. We'll talk about how to deal with your phone, your email, and your website. We'll discuss outstanding payments. And finally, we'll discuss what to do with equipment with access to PHI. We'll focus only on interactions with patients, since requirements for notifying other parties like staff members or employees, relevant hospitals and healthcare organizations, government agencies, state licensing boards, and other professional associations are well documented elsewhere. Also, we won't cover topics related to handling HR and accounting records for the same reason. You'll need to notify your patients that are actively being treated and require regular prescription refills, especially if they've been seen by your practice within the last 2 years. It's also a good practice to notify your patients 6 months prior to your retirement date if possible, or at a minimum 60 to 90 days prior. This will give them enough time to decide how to proceed, to select and be accepted by a new provider, transfer their records, and what's more important, to give the patients an opportunity to see their new providers while you're still working, so that the new providers have a chance to reach out to your office for any additional input or additional information. We suggest consulting a local attorney to understand the laws governing patient notifications in your state. For example, some states require placing announcements in the local newspapers. So here are some common practices related to patient notification. A formal letter should be sent out to each of the target patients, and you can attach a copy of that letter to their charts. Patients who've opted to receive emails or who've opted to receive SMS text messages can be notified in those ways. It's a good practice to include a notification about your upcoming retirement in the billing statements sent to patients. Your email signature can be updated with a retirement notification. An announcement can be added to the automated attendant, virtual receptionist, and voicemail greetings. An announcement should be added to your website, on your social media pages, like Facebook if you have one, and on your Google My Business listing that will show up on Google Maps and Google search results pages. You can also issue a press release in the local area. Now, patients have a right to obtain a copy of their health records or to request the transfer of those health records to another provider. Before providing a copy of the health records, the patient and/or their authorized representative must be properly authenticated, and their contact information must be verified and validated. Before transferring those records to another provider, that provider must be authenticated, and their contact info, such as email address or fax number, must also be verified and validated. Patient records must be provided in the requested format as long as they're readily producible in that format. Otherwise, in another available format, within 30 days, in compliance with HIPAA security and privacy requirements. Patient records can be exported from the EHR system as needed. You can also scan and verify and validate all paper copies and X-ray images. But if you have original hard copies of paper records and X-ray images that have been converted to an electronic format and are not planned to be retained, they must be disposed of in compliance with HIPAA regulations, meaning properly shredded. You can export all patient forms and records uploaded through your website, as well as records you've received through email, fax, and other means. And all patient records need to be organized and easily accessible. copy of all patient records must be retained for 6 years according to federal HIPAA law, and there are specifics depending on each state. For example, 7 years in the state of Connecticut. These records have to be protected in compliance with HIPAA security and privacy requirements. Online patient forms can make it easier for patients to request copies of their records or to transfer their records to another provider. You can reference these forms on your public website, in your announcements, in the Google My Business posts, in patient notifications sent via email or text, SMS, and in letters sent to patients. If the patient portal is owned by your practice, it can be shut down. However, if it's shared with other healthcare organizations, the retiring provider, you, can be disconnected. Before the retirement date, you can add automated announcements to inform callers about the upcoming retirement. Along with that, you can provide information with instructions about how they should proceed. Staff can start reminding patients in their phone, texting, and email interactions about the upcoming retirement. Now you should prepare to disconnect the phone service in the office. Office phone numbers can be switched off after you retire, but it's a good practice to maintain an automated announcement for at least a few months longer. Here are a couple of examples about how to handle the office phone after retirement. You can have an automated telephone announcement to let callers know about the retirement. For example, please listen to this message. Doctor, your name, retired on your date of retirement. If you need to obtain a copy of your medical records or to make outstanding payments, follow these instructions. For additional information, please visit our website at your website address. Calls can be forwarded to another office, if applicable, after the announcement. Here's another example. Going forward, the Office of Name of Provider or Practice will be providing care for our existing patients. If you'd like to be connected with that office, please stay on the line. Their direct number is, and fill in the number. You can do the same sort of thing with email. Post-retirement, incoming email messages should be rejected with an auto-reply to inform senders about your retirement and provide information with links. Here's an example. Attention! Doctor's name, you, retired on such and such a date. This mailbox is no longer active. For more information and about how to obtain your health records, how to make outstanding payments, and to see doctor recommendations, please visit our website at your website address. Now, it's a good practice to maintain the website for at least a few months after the retirement date. It should include the information for patients about how to obtain patient records, how to submit outstanding payments, and other providers patients may consider transferring to. Now, what about equipment with access to protected health information? Printers, scanners, fax machines, all must be properly disposed of in compliance with HIPAA regulations. That is, all internal memory must be destroyed or securely wiped out. PHI stored on computer disks, USB drives, memory cards, on the internet must be properly deleted. CDs and DVDs containing PHI must be destroyed. So in summary, before your retirement, you should make an announcement. You should provide forms for patients to obtain or transfer their health records. And you should consider porting your office phone numbers if applicable. After retirement, you should have an automated telephone announcement. You should have an email autoresponder. Your website should have instructions for patients. You should digitize and organize patient records. You need to dispose equipment with access to PHI. You need to handle patient requests to obtain or transfer their health records. You need to handle outstanding payments, and you should think about shutting down your patient portal or disconnecting from a shared provided portal. Thank you for watching. We hope you found this presentation useful. Do you need help with this process? We can make it easy and hassle-free for you. To inquire about our affordable, flat-fee services, chat with us at officeflow.com/chat. Contact us at retire@officeflow.com or call toll-free at 1-833-2-INNOV8. Thank you.